it's extremely important at this time to quit smoking. We know that from COVID, anyone who has a comorbidity, such as a lung disorder or diabetes or high blood pressure, are at much higher risk of developing complications to COVID. Throw smoking on top of that, that's another huge comorbidity. So you further increase your risk of dying from COVID as a smoker than you would as a non-smoker. Sure. Smoking obviously affects the lungs. It's a risk factor for lung cancer, COPD, which is emphysema or chronic bronchitis, heart disease, diabetes, and hypertension. Those are some of the major diseases. But what some people don't realize is that it actually affects all parts of your body. I think when we look at people that stop smoking, immediately there's a reversal of some of the damage that occurs in the lung tissue. So, for instance, we can start to see that there's less damage to certain structures in the lung as soon as the insult of smoking stops. Another long-term improvement is one's blood pressure, because as we know, smoking constricts blood vessels, and once you stop that constriction of those blood vessels. I think one of the things that we have to realize is how about the secondhand smoke population? And I read an alarming statistic the other day that 41,000 people die every year from secondhand smoke. So let's just think about those that actually quit smoking and the impact that they have around people that they interact with, and how they will help out so many other people from not exposing them to secondhand smoke. It's been proven that if you work with a healthcare professional, not necessarily a physician or a doctor, that your chances of quitting tobacco use are much higher. So one of the tips is to connect with a healthcare provider, whether it be a nurse practitioner, a physician, and talk to them. Most physicians, most nurse practitioners know about tobacco cessation and will offer patients some opportunities to quit smoking, not necessarily from a pharmacological aspect or a medication aspect, but maybe from a psychological aspect. So those are some of the great resources that you could utilize in quitting smoking.